Deuk Spine Institute. Today is November 25th, 2025, just 2 days before Thanksgiving. And today is a very special day. Today is the day that my son was born, on Thanksgiving in 2004. Came into my life, blessed my wife and I and our entire family with his birth. He was a healthy baby, born on Thanksgiving Day at Parish Medical Center. He was born in the morning on Thanksgiving at Parish Medical Center in Titusville, Florida, which is, of course, the home of our space program since the 60s, even before. And he was born in a town, Titusville, to commemorate the Titan rocket program, which was one of the first rockets used to launch a space capsule into space and return to Earth. Today is his birthday. He's 21. And it's a special day. So, we'll be streaming live surgery today. We have 5 surgeries and 4 of them will be streamed. Our first patient has 2 herniated discs in her neck. C4-5, C5-6. We're going to get started. If you have questions, feel free to type them up. All right, how relaxed are we? You have any twitches? Zero. All right, let's just see here. The first thing I have to do is get into the disc that I'm going to repair. She has 2, number 5-6, number 4-5. Everyone agrees? We'll try to start at 5-6. I feel the spine quite well. Everything feels good. Let's get a shot. So it's a little bit lower than I want to be, which is good. We want to be a little higher. Higher is sometimes easier to get to. Right there. Shot. 2, 3, 4, 5, 6. We're right over 5-6. It looks perfect. I can feel the spine quite nicely. Shot. All right, so let's go ahead and get down to 5-6. Shot. AP. You can see how damaged the disc is at 5-6. She's got huge bone spurs. AP. That's perfect. We're dead center. Show us the dead center, Jordan. You guys see the tip of the needle there? It's dead center of the spine. That's perfect. That's exactly where we want to be. Now look how destroyed that 5-6 disc is. Okay? That's the first disc we're going to fix. Look at the bone spur coming off the front. That's a huge spur. So this disc was injured many years ago, and it's degenerated over time because of inflammation. Look at the disc above. That's the second disc we're going to fix. That disc is not as badly damaged. It's more well preserved to the normal anatomy. So I'm going to go ahead and advance into 5-6. 2, 3, 4, 5, 6. And we're going to do a discogram shot. If you have questions, feel free to ask. I'll do my best to answer them. Shot. All right. You can see how irregular the end plates are. I'm going to try to get in just a little bit more. Shot. I'm going to try to get back a little bit further. Man, give me a little inline. A little bit of inline, Berndes, and a little, just a gentle tug. I see how much it opened. That's nice. Yeah, shot. All right, perfect. You guys did a great job. A little inline traction really opens up the disc space, especially when the patient's relaxed. We're going to do a discogram. This is where we inject dye into the disc. Now, shot. This is not an evocative discogram. Shot. Look at that. Wow, what a huge tear. So the dye allows us to see a tear in the back of the disc called a posterior annular tear, and that's where the neck pain comes from. Henry, let's show the audience the 30 different causes of neck pain that we commonly see. That's chronic neck pain, and we'll talk about those causes after you watch the video. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain.
Welcome back. So at this point, we have gotten into the C5-6 disc with the dilator. We're moving that back to the back of the disc. Jordan will show you. This is the severely degenerated disc at C5-6. So the Deuk laser disc repair can still eliminate symptoms even at a degenerated disc. You do not need fusion. You do not need artificial disc. Those procedures are invasive, destructive, and high risk. All right, let's go ahead and do a little bit of inline traction. By the way, we've lost literally 2 drops of blood the whole surgery. Let me know when you guys are ready. 1, 2, 3, shot. All right, we're gonna do a little inline shot. Almost there, it's almost perfect. That looks another millimeter. Okay, that's good. Now we're gonna put our tube down. The whole surgery is done through a 4mm tube. This is the tube, folks. We're gonna fix this disc at 5-6, then we're gonna go up to 4-5. Again, the incision is 4mm. We've lost literally 2 drops of blood. Hold on. Shot. So far, everything is going really well for her. You're watching the most advanced spine surgery in the world for disc problems. It's not artificial discs anymore. It's not fusion anymore. Certainly isn't laminectomy or foraminotomy. Those are highly destructive. Little inline traction. It is the Deuk laser disc repair. We've been performing the surgery now for 20 years at Deuk Spine with 0 surgical complications. And our patients get 99% symptom elimination on average. All right, we're making our way to the back. You can see the tube is advancing. It's not easy. This is a difficult one because it's so collapsed. All right, dilator moved 0.5 millimeter. So I'm gonna go ahead and see if I can get it just another. I'm gonna bring the dilator back. I don't want it going forward anymore. Go ahead, Luis. If you have any comments or questions, go ahead. This is a good time to ask. Shot. That's perfect. Leave it there.
We have a comment from Jason on YouTube.
Sure, Jason.
Saying, hi, Dr. Deuk, long time no see. I hope all is well. Just checking in because I am intrigued in what you do. My back has momentarily settled, but I know it will strike again.
So, thank you for checking in, and happy holidays to you, Jason. Jason and the Golden Fleece. Jason and the Argonauts. Look at that. We're literally moving 0.5 millimeter at a time. I'm just about done. I think that's going to be perfect right there. I'm happy with that. Now take a look, folks. We're going to get this dilator out, and you're going to see the tube is literally sitting in the back of the disc where the herniation is. I'm going to use the laser to remove the herniations.
And we're going to take the tube out. There's no fusion, no metal, no plate, no screws, no bone graft, no cadaver bone, no hospital, no pain meds afterwards. This is the most advanced surgery in the world, and no bleeding. We lost 2 drops of blood the whole surgery so far, and we're not going to lose more. All right, let's show the audience how it is that a disc herniation can be the #1 cause of neck pain. How do disc herniation, bulging disc, ruptured disc, extruded disc, degenerated disc, protruded disc, spondylitic disc, how do all those, which are the same thing by the way, how do they cause so much pain in the neck?
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Hey, welcome back. I need my pedal, guys, right here on my right foot. Thank you. Is the laser ready?
Yes, sir.
All right, here we go. All right, welcome back. You can see from our video that there's a tear that occurs in the back of the disc, specifically an annular tear, which is the wall. The annulus fibrosus is actually like a ligament that connects the top vertebral body to the bottom vertebral body. What is that? What's going on, guys? Everything okay? What's the popping noise?
I think it was just the suction.
All right. So this ligament or annulus is what it's known as, annulus fibrosus. It's a ring ligament that wraps around from the entire vertebral body, one around the circumference, okay? Because the vertebral body is circular, so the annulus is circular. And it goes all the way around. And what happens is when you have trauma, it tears. It tears that, let's flip. It tears that annulus or ligament, and then it allows the jelly from the center to come out. Any way we can increase the lighting just a little bit? What do you think, Luis?
It's all the way up.
There's something wrong. Is it plugged in all the way? Is it the light box? Or is it the cable?
Maybe it's the cable.
Give me a new cable.
We have another, please. Thank you.
All right, so when you have that tear in the back of the disc, you can allow the jelly in the center to escape. And that's called a herniation. If it's a small herniation, it's called a bulge. So far, it's hard to tell how big the herniation is. This is right here is herniation, right there. But I haven't gotten in the foramen yet. I'm more paracentral right now, just to the side. That's the spinal cord down there. You can see it, but there's some bone spur here. You see the bone spur right there? That's bone spur, right there.
Yes, we do.
Is my laser on? Yeah, it's disc osteophyte, for sure. Let me know when you're ready. Yeah, I want the power to be the same as it always is.
Yes.
Okay? What I need is a little bit more light.
When you're ready. We're ready.
All right, let's switch it. Hold on. We're going to switch the light cable. Don't contaminate this one. Let's just switch it.
Turn on, please.
That's brighter. Let's see. Well, let's see. Hold on. Well, the cable looked brighter. You don't think it's the scope or the power source, do you? Interesting. We're just commenting on how dark it is down here at the bottom of this disc. Let's get let's flip it.
Yes, sir.
Okay. Any questions?
No current questions, but we do have a comment coming from Thomas on YouTube.
All right, Thomas.
Speaking to Jason, saying, Jason, speaking from experience, Dr. Deuk and the crew are the real deal. Go for it. You'll be glad you did.
Thank you. Thank you so much. All right, so you can see the gold color is calcification, and I'm starting to get some play in the tube at the back here. You can see it kind of windshield wipering. I'm trying to go from left to right side, and you can see all this junk here. This is all herniation, inflammation, bone spur, scar tissue. This is all scar tissue right here. Man, that's calcified scar tissue. This is so like tough right here. Yeah, been there a while. So when, do we know when the accident was? I know she had an accident, huh? 5 years ago? This to me looks older than 5 years. So I think she may have injured C4-5 5 years ago, because that's what C4-5 looks like. But this thing is older than 5 years ago. This right here looks like around 30 years or 40 years. Yeah. So apparently the patient was in a car accident when she was 7 years old, and that's when this disc was injured. That's what I would be willing to bet. But I want you guys to pay attention here. You guys see the scar tissue and calcified herniation right there? That laser is removing it literally a third of a millimeter at a time. Every pulse is taking away a third of a millimeter. There is no instrument in medicine as precise as this here laser. And what makes it precise isn't just the laser. The laser itself is very precise, but the endoscope that I'm using allows me to visualize in such magnified view. Everything that's down here is so easy to see, like zoomed in. It's almost like using a microscope, but not quite. It's called an endoscope. So with this thing, I'm able to actually see almost microscopic details. And because of that, I can adjust the laser tip so that it advances at basically 1/20th of a millimeter is the most resolution I can get on the laser. It is the most precise and accurate instrument in medicine. But there's a lot of herniation. Look at how hard this stuff is. It's golden color, meaning that it is calcified. This stuff is like a rock right here. Like I feel like a geologist studying rocks right now. That's how hard these herniations are. These have been here a long time. This is not a new problem, at least at 5-6. Now 4-5 is a different story. That's a softer herniation, a newer herniation. Any questions? This is 5-6. This is the degenerated disc. And you can see how nicely the laser removes this scarred up herniation right here. Now I want you guys to know something. This is the herniation. This is the back of the disc. This is the herniation. Other doctors cannot get this out. If you go and get an ACDF done or an artificial disc done by a doctor, a surgeon, this material back here will still be here. And that's why so many people have problems after having anterior cervical discectomy and fusion or artificial disc, because the surgeon did not remove the herniation, because they can't see it. They have no way of seeing this level of detail like we can arthroscopically. Here's a bone spur. Goodbye, bone spur. Yeah.
But look at all the scar tissue. It's really amazing. And it's basically, all this is scar tissue from chronic inflammation, her body trying to remove the herniation itself, unable to do so. The herniation cannot be removed by the human body. When you hear these nonsense on the internet about just give it time and it'll shrink and go away, the herniation will, that's not true. It's absolutely 100% not true. These herniations stay here your entire life until a surgeon removes it. There is no other way to remove it but surgery. Now there's two types of surgery. There's open or invasive, such as anterior cervical discectomy and fusion. That you take the whole disc out, including the herniation. At least you're supposed to. A lot of doctors don't because they can't see back here. And then you have artificial discs, arthroplasties. So the difference here is that we are in the back of the disc, right inside the herniation, removing it. And you can see it being removed with your own eyes using this laser. For those of you who don't know, the laser fiber is 1/2 millimeter wide. So what you're seeing there, that whole glass tube right there, is 0.5 millimeter, 1/2 millimeter, okay? And that's what allows the surgery to be so precise, is that we can see down to about 1/20 of a millimeter, okay? And we can use the laser to do removal of tissue. What is that noise? Come on, guys. All right, any questions?
Yes, we have a question coming from Lanu on YouTube.
Hello, Lanu, welcome.
Asking, she seems to have herniated disc for decades. Why did she
Yes.
wait such a long time to get treatment now?
That's a great question, Lanu, great question. So let me tell you why. Number one, how many people have herniated discs? The answer is every single human being over the age of 40 has a herniated disc. How many have symptoms from the herniation? Only about 10%. So we don't do surgery on patients who don't have symptoms. We only do surgery on patients who have symptoms. So she probably had this herniated disc for many years without even knowing it. Remember, she probably got this herniation when she was 7 years old. She was in a car accident when she was 7, a very bad car accident. But of course, how many 7-year-olds complain about neck pain? They don't. So what happened is, as she got older, the herniations got more and more severe, and they started to get bigger and bigger, and the inflammation got worse, and basically it all added up. So think about it like a bag of marbles, right? What do you do when you have a bag of marbles? Well, if you put one marble in the bag, it's not so bad. Then you put 2, then you put 3, then you put 4, and it gets bigger and bigger and bigger. And each of those marbles is another herniation, okay? Yeah, oh, look at that. There's a piece of herniation that just snuck out. So Luis. Yeah, apparently she's been active in her life, so she's kind of probably just did what everybody else does. You know, live with the pain, and basically what's called fear avoidance behavior, where the patient has the pain, but they learn how to minimize the pain by restricting activities and not doing things, right? So what happens is they get robbed of their quality of life to avoid the pain. When all you have to do is go to Deuk Spine Institute and have our Deuk laser disc repair, and the pain will go away permanently, and you can do whatever you want in life. Okay, so this, on a scale of 1 to 10, this surgery is a level 10. This is as hard as it gets because of all this. That's the nerve root right there. You guys see that right there? That's her nerve root right there. I'm pushing on the nerve root. I'm not zapping it, I'm pushing on it. But look at all this stuff that was here pushing on the nerve root. It's now gone. I cleaned it out. So she had a lot of old herniation and scar tissue right here. That's the uncinate process right there of C6 starting to sweep up. There's the neuroforamen. I don't see any more herniation in the foramen. The nerve root looks decompressed. Everything is looking really good. I'm going to go back to the other side now. to her right side and just look again. And because there was some herniation here as well. Look at that. Still some herniation. All right, so we like to talk about movies. Why? Because movies are amazing ways for people to learn about the world, culture, everything. And I'm an 80s child. I grew up in the 80s. I was in my, I was born in 70, so I lived through Star Wars being released and a bunch of interesting movies, from the 80s. All the Indiana Jones movies, Raiders of the Lost Ark, and I mean, these are great movies, right? Star Wars trilogy, the original. Star Trek, which was not a movie. It was a movie, but it was mostly a TV series. So I grew up being educated by movies, okay, like everybody in the 80s. That's how we learned. We learned in school, we learned in church or synagogue, and we learned through movies, right? And we learned from actually going out and doing stuff with our friends. Can't tell you how many rock fights I was in as a kid. And riding a bicycle, like a dirt bike, like a mongoose or red line, that was a thing to do. So I grew up in that era, and I was an outdoors kind of guy. But one of the movies I really enjoyed horror, all right? And Stephen King was my favorite author. He still is. I don't agree with his political views, but I love Stephen King and his writing. And he's probably the greatest storyteller, him and Spielberg. Long story short, I was watching an old movie that you guys should check out. It's a great movie, Invasion of the Body Snatchers. Invasion of the Body Snatchers. How many of you guys have seen that? Oh my gosh, shame on you. Invasion of the Body Snatchers. It's an old movie. And it's got really an all-star cast. But check it out. That was when there was real horror. Man, the stuff today is so ridiculous. I just don't even watch it. It's just not even scary. This old stuff is good. You know why the old stuff is so good? It's because they didn't have CGI. They didn't have computer-generated imagery. They had to rely on models, and they had to rely on lighting, and they had to rely on storytelling and plot development and character development. They had to rely on the things that really scare you. Go ahead. So it's very different kind of movies. All right, disc number 1 done. We're going to go on to disc number 2. Any questions? Yeah, don't ask that one.
No worries.
But come back. Any questions?
No current questions.
Are we back?
We are back.
All right. So our patient's doing fantastic. She is done with 1 disc, and now we're going to move on to disc number 2. So to do that, I have to slide up the spine. And this is truly the hardest part of the surgery. So I'm going to just take a moment to do this, and I'll walk you guys through it. But as I work on this, Henry, let's show the audience how the whole laser surgery works.
Of course.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
No. Welcome back. You can see from our video how the patient's disc can be repaired using a laser, and that's what we're doing. But it can't be done just by laser. It must be done by shot. It must be done by laser and endoscope. The laser itself, the surgeon cannot see down there to use the laser precisely. You can't see. It's a tiny little hole, right? A tiny little tube, shot. And the truth is, to be able to use the laser to its fullest, you must combine it with the endoscope. All right, I'm going to move up to the 4-5. That's our second disc, second and last disc. So I need to just pay attention for a moment. So if you have questions, type them up. All right, shot. And I feel the bone spur. Man, there it goes. We're outside. Shot. All right. Let's get an AP and see where we are. I want to be in the middle, so I'm going to make an adjustment if I need to be in the middle. Shot. Quick shot. All right. We're just a little bit to her left, so I'm going to come back to the middle. Shot. Still to the left. Hold on. A lot of bone spur here. Now, it helps, shot, that I've done 1,000 ACDFs and artificial discs. Those are open surgeries. I've done 1,000 in my career, more than 1,000, but that gives me a very good understanding of the anatomy. Shot? So I've seen these bone spurs in real life, and I've treated them. I know what they look like. Is that it? AP? So I'm happy with our lateral view. I want to take a look at our AP. All right, we're perfect. We're dead center. You guys see that? We're right over the spinous process. No, not yet. Shot. So I'm a little bit on the bottom side of the disc. I want to come up north just a smidgen. Shot. Shot. That's perfect right there. Let's get another AP. Whenever you move your dilator, you must get the AP view. You got to get AP and lateral. You must be 100% confident where that dilator tip is. If you're not, you can really hurt the patient badly. This is what scares most surgeons. Shot. All right, looking good. Shot. All right, I felt it move, but I'm going to get another AP because it could have moved to the side, and I don't want it to move to the side, so I got to get another AP. This is the most critical part of the surgery. Yep, perfect. We're still centered. That's what I want. So a lot of times it's hard to get that dilator to go where you want because of all the bone spurs. No, we don't need in line. We're perfect. Shot. I'm going to go back a little more and do my discogram. Shot. All right, so we're inside. Everybody agree 2, 3, 4, 5. We're doing 4, 5. Yes, this is second disc. This is the last disc for this patient. I'll do a discogram. We're going to see a tear in the back of the disc, I'm sure. This is, so she had 2 accidents, I think. She had one when she was 7 years old, which was a long time ago. Let me get this. I've got a floppy needle trying to get it into a millimeter size hole. All right, shot. Perfect. 2, 3, 4, 5. Discogram shot. And there's the tear. Shot. One more. All right, there's the tear. You guys see it?
Yes, we do.
And then you see the blush, which is coming out the back of the tear of the disc, and that goes around the nerve root. So that dye is going around the nerve root. That would be the C4 nerve root. All right, very good. I'm going to advance my dilator into the tear. So we're going to go inside that tear to the back of the disc where the herniation is the worst. Shot? All right, perfect. So what I was saying earlier, she has 2 herniated discs. One is severely degenerated. I think that one was injured when, she was 7, which was, many years ago. And then the more recent disc that was injured is the one above it. Okay, shot.
At this point, we're going to advance the tube down the dilator. I don't need traction. Shot. Now remember, this disc is more preserved than the last one, meaning the height is preserved. Shot. Everything is more normal. This is like a more recently injured disc. It's not collapsed and degenerated like the other one. So this is probably the one that's contributing a lot to her arm symptoms. She has weakness in her left arm. So we want to go and find that pinched nerve and unpinch it. Shot. All right. So the dilator keeps popping back because this disc is under a lot of pressure. Any questions?
Yes. We have a question coming from Thomas on YouTube.
Hi, Thomas.
Asking, in your animation,
Shot.
the herniation is represented by a round ball shape. Is that an accurate depiction of what you see, or is that just animation?
No, the herniation is really not one herniation. It's really about 20 pieces. So it's not really, it could be more accurate, but it's accurate enough for most people to understand what's going on. The herniation is not one big ball. It's actually about 20 pieces of disc material that come out over time, right? Over years, usually, not one time. A lot of people think a disc herniation is one piece and that it comes out at one time. That is never the case. I've done 2,800, almost 2,800 of these surgeries with the endoscope and the laser. And in 2,800 surgeries, I've never seen just one piece of herniation. It's always at least 3, and I've seen as much as 40. So it's between 3 and 40. If I had to pick an average number, it's 20. All right. Here we are, 4-5. And there's the laser right there. Yeah, we just got to do a little figuring out on the lighting here. But it's okay. It's not optimal, but it's okay. All right, so there's herniation right there. Big piece. Any other questions?
At this moment, no current questions.
All right. So in that case, let's share with our audience the alternative treatments and why is the Deuk laser disc repair the best treatment. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatments such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones, such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work. They're dangerous. They put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're going to have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deukmedjian. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you.
Welcome back. You can see from our video that Henry made, which was an incredible accomplishment, comparing Deuk laser disc repair, which is what we're doing now for this patient, to other treatments available out there to patients who have herniated discs. And we believe the Deuk laser disc repair is the best treatment because it's the least invasive, fastest recovery, most successful treatment, and it lasts a lifetime. There's another piece of herniation right there. Man, that thing just snuck in there. I'm going to try to grab it out. We're just about done. I was looking out the foramen on the left just there at C4-5, and I didn't see anything else there. But, oh, I might have it. No, too big. I think it's too big. It's not wanting to come out. I'm going to have to laser it in half. Call it bivalve. If the disc herniation is too big to fit up this 4 millimeter tube, I'm going to have to bivalve it with the laser. Cut it in half and then take those pieces up. So if it's a 6 millimeter piece, it won't fit up the tube, right? But if you cut it in half, it will, because each half is 3 millimeters. There's another piece. That's not even the piece we were looking at. All right, we're just about finished, folks. So if you have questions, this would be the time to ask.
We have a question from Hookem1963 on YouTube asking, is anything done to repair the anterior portion of the disc at C5-6 and remove the bony deposits there?
That's a great question. The answer is no. You don't need anything done there. It would be unnecessary, superfluous. Yep. Don't need to fix the anterior part of the disc. It causes no symptoms whatsoever. None. We're not going to fix things that don't need to be fixed. It would expose the patient to unnecessary risk. And flip it. We're just about done, so get your last questions in. That's a great question. Thank you for asking. Oh yeah, there's another piece right there. Looks like a stingray. Yeah, they're all good size. And
She's going to be very happy. We got rid of all these herniations. All right, literally seconds away from being done. Any other questions?
At this moment, no current questions.
Great, so we'll be back shortly with another surgery. Our next patient has 4 discs that need to be repaired. He was involved in an assault in Mexico, my favorite place to vacation, and he got 4 herniated discs. So we're going to go in and fix them for him. I don't see anything more. Oh, let's see. What about that? That should be the last of it. That's just the annular tear. It's already debrided, but I'm going to clean it up a little more because I don't want to come back and do another surgery. Any other questions, Henry?
At this moment, no current questions.
Great. We've already shown the videos on how a herniation causes symptoms.
Correct.
Why the DLDR is the best treatment.
Yep.
And how the DLDR works.
Yep.
All right. We're done. Thanks for joining us. Henry, let's share with the audience a testimonial of one of our patients.
Of course.
I'm Dr. Deukmedjian with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4-millimeter cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did. And they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I couldn't. I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
Thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right. Let's get you out of here, okay? Go enjoy the beach or something.